The current nursing issue we have chosen is anaphylaxis due to a transfusion reaction while administering blood. Anaphylactic shock is an acute systemic type 1 hypersensitivity allergic reaction that results from IgE antibodies. The target audience is third-year nursing students learning how to administer blood and blood products. Marin playing the patient, Michaela playing the RN, Michelle playing the RN, Lizzie playing the doctor and the narrator. Cindy Pepper is a 22-year-old female who suffers from thrombocytopenia. As per doctor's orders, 2 registered nurses have followed the blood administration steps and hung 1 unit of fresh frozen plasma 5 minutes ago.
Are you okay? Just breathe. Okay.
Signs and symptoms of anaphylaxis include coughing, nausea and vomiting, hives and urticaria, respiratory distress, hypotension, tachycardia, loss of consciousness, and cardiac arrest.
Hey Michaela, I think she's having an anaphylactic reaction. I'm going to need you to give her some oxygen, do her vitals, and do an assessment on her. I'm going to stop this blood and put on some normal saline at 50 cc's an hour to keep her vein open.
Okay, Cindy, I'm just going to take some breath signs for you. Just try and breathe as normally as you can. Everything's going to be okay. Okay, here are her vital signs. You can take that to the doctor and
Perfect.
let him know. And I'll stay with Cindy and make sure everything's okay.
Okay. Hi, Dr. McBride. This is Janelle calling about your patient, Cindy Pepper. We're administering her plasma, and it looks like she had an anaphylactic reaction. Her heart rate is 140 irregular, her BP is 80/59, her temperature is 38.3, her rests are 28 and shallow, and her O2 sats are 86 right now.
Can you please administer 0.5 milligrams of epinephrine and 50 milligrams of Benadryl IM? And can you also run normal saline at 125 cc's an hour and titrate O2 to keep sats over 90%? And I'm on my way.
Okay, Michaela, I have the doctor's orders. Okay. I'm going to need you to set the normal saline at 125 milliliters an hour. I have 0.5 milligrams of epinephrine and 50 milligrams of Benadryl to administer intramuscular.
Okay.
Nursing interventions for anaphylaxis include stopping the transfusion, running normal saline, applying oxygen, assessing the patient, placing the patient in the recumbent position, notifying the physician, administering epinephrine and Benadryl, sending blood products to the lab, documentation, and preparing for possible loss of consciousness or cardiac arrest.
Hi Cindy, how are you feeling?
A little shaken up, but I'm okay.
Okay, we just wanted to let you know what happened when you were receiving blood. So you had an anaphylactic reaction, and now that you're stable, we're just going to watch you for the next 12 hours. So if you have any changes, just press your call bell and let us know.
Okay.
Do you have any questions?
No, thank you.
Following the transfusion reaction, the nurse verified the patient's identity, sent the blood back to the blood bank for type and cross-match, completed a transfusion reaction report, assessed lab values, provided patient teaching, documented interventions performed and the patient's response to the interventions, and continued a thorough assessment for 12 hours.